First of all, let me welcome everybody here. Very glad to see you. We have, and I've got Wayne Turley showing up on my screen right now, and we've got a great big buck on the wall behind him. It's pretty cool.
I'm sorry, I can take that away if you want.
No. I like it. I like it. So anyway, welcome here today. Roy, we're going to turn the time over here to you in just a minute. I'm wondering if you would feel comfortable talking about when a product would be appropriate, not only for individual, but for groups, employer groups, union groups, things like that. I'm wondering if you could just sort of touch on that when you see an opportunity. And I'd like to, if you don't mind, I'd like to sort of quickly introduce Rory. He sent us an introductory blurb, and I'm enjoying reading it. So I'm just going to hit some highlights here. He says that he was born and raised in Florida, and he says that it is the Medicare capital of the world. And I see no reason to doubt that. People in Arizona the population is not even close, right? So
Arizona's a top 5 state.
Okay. It's not even number 2, huh?
I don't know officially. I'd have to look at the stats, but it's definitely a top 5 Medicare population state for sure. Okay. Texas, New York, Florida, California, Arizona.
Okay. It's good to hear that. So anyway, Rory was born and raised in Florida. He's living now in the greater Jacksonville, Florida area. He says about 35 minutes south of St. Augustine. He has a son who's 12 and a daughter who's 8. And he's been with his wife for 23 years. He loves sports, big Jaguar and Gators fan. Played baseball up into college. And he's an outdoor sportsman, and so I don't know if sportsman means he says love to surf and fish. So maybe you'll have to talk about Wayne and his trophy wall there.
Yeah, impressive.
And it looks like Rory's a traveler. He's been to Australia, Fiji, Costa Rica. He's been a Medicare agent for 13 years. Worked for 2 other major carriers before being recruited to Allstate a year ago. He's very passionate about senior products and well-versed in traditional insurance products and services like dental, life, and more. So, Rory, you feel comfortable, I take it, doing a presentation. So let's turn it over to you.
Cool. I appreciate it. Thank you for the intro. Very, very nice. Well done intro, Doug. I appreciate it. Yeah, very stoked to be here with you all today. Got about a dozen people on the call, and really excited about the opportunity to continue to build a relationship with Stonehill and all your agents. Yeah, been in the game now, going on 13, 14 years. Like Doug mentioned, worked for 2 major carriers for 12 plus years before I was blessed to be recruited by the Allstate Health team a little over a year ago. And just a wonderful team of people. And honestly, and I know it's a big statement, but I'm happy to always say it is the team here is the best team of people I've ever worked with in my career, for sure. We have a great collaborative team. Obviously, everything transitioning from the roots in National General, and then, being acquired by Allstate many years ago now, and then everything rebranded in 2022 and beyond. And went from being a A-rated carrier, $5-6 billion company now to this $60+ billion machine and A+ rating and
how may I help you?
AM Best and all that.
Uh-huh.
Terry, you're getting busted here. You got to.
She did.
Roy, it
Wayne,
seems like your mic has muted. Rory.
I turned off Terry and it muted you, Wayne.
That's all good. We'll get through this. But yeah, anyways, super excited to be here. I'm super passionate about senior products, and Yeah, I actually worked in technology for over a decade before I got into healthcare. So, and I would never look back. But I'm very tech savvy too. So, and at Allstate Health, it's all about service and care before product. So, beyond good hands and great rates and A+ rating and AM best and all those other brag sheet things, it's all about service and care before product with us. So, because without service and care before rate and before product, what's it worth? So that's one of the things I really love most about working here is, we provide what we think is the best white glove and red carpet treatment in the industry. With that said, we can dive right in. Let me go ahead and get into present mode. I have to refresh my memory on how to share here in a tab because I know Google Meet's a little bit different here. Let me change.
You see the rectangle down at the bottom of your screen with an up arrow in it?
Yeah, I'm there. I got the window popped.
So you have to press something in the window prompt. So even if it's the only thing that's open, you have to press at least something in there.
Yep, there we go. So, it's doing the cascade thing. I remember this glitch. Let me see if I can bring this up because I'm in multiple screen mode. So let me know if everyone can see my screen. Can you see my PowerPoint?
No.
Okay.
We see a black screen.
Let me bring it back down. Can we see the PowerPoint now?
Nope, still seeing the infinity mirror. So,
Well, I apologize.
No worries.
I haven't used Google Meet in a while, so let me.
So is it on a particular tab? Your presentation?
No, it's not. Yeah, I have it saved down in my. I have one major screen. Let me see if
Is it a window? Is it open in a window?
No, it's just in my dock. Sorry, I apologize. I haven't used Google Meet in a hot minute, so I need to see if I can bring this up into a tab because I know Google is more driven into the tabs. Okay, here we go. Yep, no, I can do it now. Like I had to switch screens. I figured it out.
Okay.
There we go. You got me there?
Yep, we're seeing it.
Good. I told you I'm pretty tech savvy. Just give me a minute to get back on the ranch here.
Very cool.
All right. There we go. All right. Everyone see the presentation?
Yes.
Medicare supplement.
Perfect. All right, let's rock and roll. All right, so this is my regional support team. Many of you have probably spoken to Eric Almasy and Mary Steele in the past. So Eric is our regional director out of Arizona. So he handles all of our individual products. Mary Steele handles our under 65 products. And then myself, I am the senior product guy. And then we have our right-hand lady, Misty, at our HQ. She's our RSA, Regional Sales Associate. So she handles all of our contracting, commissions, and all those good things. So she's a great help and asset to our team. And if you want, you can always pop out your phone and scan one of the QR codes next to our profiles there, and they will download to your phone, or just take a quick picture if you'd like, or a screenshot. So I'll pause for a couple seconds if you guys want to do that. And I will also flash the screen at the end of the presentation as well. All right, we'll move right along. So a little bit about our Elevate Rewards program. So we've kind of revamped this program a little bit this year. So definitely, if you are not signed up for our Elevate Rewards program, you can simply take out your phone. You can scan the App Store QR code there or the Google Play Store. or you can just search for it in the App Store or the Google Play Store. It's a very easy app to find. It has a star within a star. It's just called Allstate Elevate Rewards, and you can register today and start earning points on sales today. So you can earn points for every sale. Short-term medical is excluded, and we have a huge, fabulous catalog, as my IT people would say, of gift cards, merchandise, trips, and more. So beyond your normal commissions and quarterly bonuses, which we have that are really great, you can get lots of reward points just for, your normal sales as they go along. So they just, accumulate behind the scenes. And a lot of my agents will, just let them accumulate throughout the year and then tap into them at the end of the year to buy Christmas gifts and such. So might as well do it. It's a no-brainer. Just make sure when you log into it, you want to make sure you accept the terms and conditions. No big deal. And then you can start earning points right away. And like it says here, when you download the app and register, accept the terms and conditions, and you get an extra 250 points just for opting into it. And we don't sell your information or anything like that. It's all protected. But yeah, just an easy peasy way to earn extra points and bonus points for all your sales. And then we have your different tiers here are clubs. So as you earn points with our multiplier benefits, you get 2 points for every $1 on initial monthly premium. Again, excluding short-term medical. Plus every calendar year, you can qualify for a higher rank. And the points do roll over year to year. So we have like the Producers Club, Leaders Club, Elite Club, Executive Club, and the icon to the left of the Executive Club, that blue star within the star, that's actually what the app looks like on your phone, the icon for the app or avatar. And then the Chairman's Club. So easy peasy. I definitely encourage you to do so. If you have any questions or any hiccups on downloading that, I have a really quick sheet that I can send over to you via email that has some basic instructions on getting into it. But definitely a no-brainer and great way to earn extra points beyond commissions. So a little bit more about us. So again, like I mentioned earlier, our roots in National General trace back to 1939. We were acquired by Allstate in 2021 and then started the rebrand of everything Allstate Health in 2022. So these numbers are probably actually a little bit larger now, but 51 billion in annual revenue, 191 million policyholders, and over 54,000 employees nationwide. Solutions for all ages, so broad portfolio of individual sales solutions and solutions for all agents, industry-leading technology. I can't see the chat right now, so if anyone throws any questions in the chat, maybe someone could call them out for me, or we'll kind of open this up as well towards the end with some open forum for Q&A.
We are monitoring that.
Awesome. Thank you so much. So why Allstate MedSup? Multi-discounts, stackable discounts up to 25% in savings, increased commissions, any day effective date, and easy online SIG methods such as PIN SIG, eSIG, and Voice SIG. And we have Insta Decision on our e-apps. So, and you can download the PDF ID card almost instantly once the open enrollment app is done. We also are going to be bringing our Milliman check as a new feature into the front end of our underwriting app process here in the near future. So we're going to make that decision process a lot more streamlined as well. So a little bit more about our MedSup discounts. I love our discounts. So our household discount. So if the prospective member lives with at least one, but no more than 3 people 50 age plus, then they can get a 7% discount. So it could be spouse, significant other, roommate, sibling, whomever. So as long as they live with someone 50 plus, then they get the 7% discount. In some states, not many, but some states, it's actually 18 plus. Just depends on the state. And then we have our dual household discount. So if you're hitting a double, which is always awesome, and you're riding 2 people up at the same time, husband, wife, roommates, significant other, whomever, sibling, If you're getting a double enrollment, then they both get a 10% discount. And just like to throw it out there too, say if you're enrolling Jane Doe and she gets her 7% household discount and John Doe is there with her and he says, hey, you know, I'm turning 65 4 months from now. Well, we'll actually go ahead and accept his application within 6 months to his birth month, even when he does not have his red, white, and blue card in hand. So you can secure the business in front of you. And then they both get that 10% household discount. So you can simply enroll them with their social security number. And then once they acquire their red, white, and blue card, either before or even after effective date, because we will issue the policy, they just have to call back into member services and make sure they apply that to their account. We also, hypothetically speaking, if John Doe says, I'm turning 65 a year from now, because Jane's robbing the cradle a little bit, good for her, and she would get the 7% discount right out of the gates. Then when you enroll John a year from now, he would then get the 10% discount. You can then call back into member services and tell them that Jane referred John, and it's a dual household situation. They will apply the 3% back on top of Jane's discount moving forward as well, which is really nice. More discounts. So activity tracker discount. So we do a 5% discount for activity tracker. So if customers register their wearable fitness device and agree to receiving electronic communication during enrollment, we don't count their steps. We don't monitor people's heart rate. If they have a Apple Watch, a Fitbit, Under Armour, Google Fit, or Garmin, or they can even register their Apple phone because it uses the same Apple Health device or app, they will get the extra 5% discount. Super easy to do. And again, you know, we're not tracking people's steps, and the only communication that they receive is we give them a little hoorah text every now and then, like, hey, make sure you go get your steps in today. So one of my favorite discounts is our annual pay discount. So 10% for annual pay. So for the customers that elect to do annual pay, they get an extra 10% off, which is basically like 1 month premium free. So in total, a prospective member can get it up to 7, 12, 17, 22, up to 25% discount off of their base premium, which is awesome. So a little bit more about our discounts and our footprint. So we are in 42 out of 50 states with our MedSups right now and growing. You can see the dark blue states are our household discount states, and the light blue states are multi-discount states. So obviously in your home state, you can see you have multi-discounts, but in all the states beyond, if you write in multiple states, we have a majority of all of our states across the country have our multi-discount rates. We've obviously added more new state info this last year, and we've had a 6% decrease for Plan N in Florida and a 5% annual pay in Pennsylvania. So some annual pays are slightly different in some states, but in most all states, they are 10%. So a little bit about our rates. So we have multiple rate classes. So we have preferred and preferred select rates. So our preferred rates are offered to customers who do not smoke and fall within preferred height and weight range. And preferred select rates are offered to customers who do not smoke, fall within preferred height and weight, and have not been prescribed or recommended depression medication. Depending on the state you're in, it's either preferred or preferred select. Just depends on how it files with the state. Now, on preferred select, I just want to point out with the depression med question on there, it is not a knockout question. So if someone answers yes to that, then their rate just increases a few dollars. It's nothing astronomical. So a little bit about our MedSup plans that we offer. So to play ball in any state, you have to offer 3 plans. We offer 5. So obviously anyone pre-MACRA, which is what it says at the footer of anyone prior to 2020, January 1, the MACRA rule. If they turn 65 before that, then they still could qualify for a Plan F or high deductible F. But our predominant plans are A, G, and N. So, and honestly, in my career, I've never sold anything but a Plan F or a Plan G. All my folks, my in-laws, all my aunts and uncles, they all have med subs because their insurance dude's son, nephew, and son-in-law said, you can afford this, and I want you to get the Cadillac of Medicare plans. Some more highlights about med subs. So some of the things I love: no network, no referrals. So you can go anywhere under the sun that takes Medicare. No waiting periods, guarantee renewable plans, multiple premium discounts available, and 30-day free look. And we have access to special discounts on hearing and devices. So a little bit more about our extra benefits and services. So we offer our Amplifon hearing discount and our Active Fit Direct gym membership discount. So we use Amplifon. So 5,000 providers nationwide, interest-free financing for those who qualify, and a risk-free 60-day trial and 100% money-back guaranteed. So very easy service to use. A little bit more about our devices. So $75 hearing eval at 5,000 NCQA credential provider locations, free evals for Miracle Ear locations, 64% average savings on hearing aids, includes all major brands and tech levels. A lot of them are pushing towards the rechargeable models these days. And other services: 1 year free follow-up, 2 years free batteries, and 3-year warranty with loss and damage protection. So all very important. And Amplifon's super easy to work with. There's an 800 number they can call on the website, or they can actually opt in through the Amplifon website. I actually tested it out because I like to test things out for all my agents. So I opted in my information on their website. I had 2 people call me within 24 hours to help me set up a audiology appointment. So really nice service.
Rory?
Yes, go ahead.
We have a quick question from Gene. He's saying the medical preferred is for those outside of the initial guaranteed issue period, correct?
So, okay, so someone that is open enrollment, depending on the state. So if they are open enrollment, they're turning 65, new to Medicare A and B, and or new to Part B open enrollment application. In some states, if they allow us to ask height, weight, and tobacco, we will ask it. It does not disqualify them for their plan. Yes, they are still guaranteed to be issued on an open enrollment application. It's more for actuarial survey, but it does not disqualify them from the plan. As far as underwriting goes, it helps to put them in a better rate class, if that makes sense. So if the state allows us to ask it, we ask it. Some states do, some states don't. Did that answer our question? Sorry, I think my phone rang there. That's what pops up. I apologize. So a little bit more about our Active and Fit Direct gym membership discount. So complimentary discount program. Of course, we have tons of on-demand fitness. But now, since COVID times are starting to wane a little bit, people are getting back out to the gym. So I went to boot camp this morning. So you got to talk, right? We can't be out here preaching gym memberships and Active Fit Direct and silver sneakers or any of them, right? So yeah, I think at the boot camp class I kicked my butt at this morning. There was like 40 people there. So, but yeah, got to walk the talk, stay after it. So, like I always joke, my wife's prettier than me, so I gotta stay after it. Plus, keep up with my 2 kids. But yeah, I love it. 10,000 plus fitness centers. Their website's super easy to navigate and use. They basically just sign up through Active Fit Direct. It's $28 a month. They get a card, and then they can go to any gym they want within the network. So very easy to use, and no long-term contract, of course. And they have activity tracking that's compatible with 250 plus wearable fitness devices, apps, and exercise equipment. So lots of bells and whistles. But in a nutshell, it's $28 a month. Active Fit Direct has a super easy website. I can send you guys all the links on it as well. I think I sent Nancy most of these links already. And you just simply put your zip code in. It pulls up a map of your area, and you can pick any gym you want to go to. And if you don't like the gym that you start out with, they can change anytime they want. So a little bit more about plan details, eligibility, enrollment, and payment. So obviously, to qualify for a Medicare plan, we have to have both Medicare A and B, and are 65 years of age or older, or are eligible due to disability in a state requiring under age 65 coverage. So in some states, you can write a med sup under age 65. In my home state, yes, you can, but the rates are super high just because the risk pool is so massive. But in states like Colorado and a few other states, under 65 apps actually are pretty fair premiums. So yeah, if you got someone that qualifies for an under 65 app in their state, you can definitely write them, but not in every state. So again, a little bit more about our state availability. So this is our MedSup footprint across the country, and hopefully we will be in Washington and in the tri-state and New England area more in the near future. But a lot of those areas up into the New England area are very unionized when it comes to Medicare. So a little bit tougher egg to crack, but we file everything everywhere. So we are constantly filing and refiling to expand our footprint. Our enrollment process, we use our e-app portal. Streamlined, intuitive to enhance quoting process. They've been revamping this site since July last year. We have a team of 11 people domestically, all working around the clock to enhance our e-app portal. We've added the PIN code signature in the last 6 months, and we're actually going to be mobilizing that probably Q2, Q3 this year, hopefully closer to Q2 or yesterday, as I always say. So hopefully the PIN will be mobilized, so it'll be able to be at a station done through their mobile device soon. And we have our voice signature, and then we have our e-sig option, which is kind of like DocuSign. Or when in doubt, if you have to bust the paper out, then we can take paper applications, of course, and they can send them via paper trail through Allstate Health, and or we have the digital upload option as well.
Rory, we have one more question from Gene.
Sure.
He's asking, are under 65 applications commissionable?
Yes. Yeah, absolutely. Yeah, we don't discriminate commissions on that for sure. The only thing that's different in commissions compared to underwritten or open enrollment apps is GI apps, guaranteed issue apps like birthday rule states, or if someone has both Medicare A and B already and they're late to the show and they're coming off eligible coverage or 70 years old, then that would be a guaranteed issue app because it's loss of eligible coverage if they have A and B already, which is the most common GI you see. But GI apps only pay a one-time chip of commission depending on the state. It's like 19, 25, and or 10% depending on the state. But if you ever have a question of what is a GI app, or is this an open enrollment app? Again, the easiest way I always educate people on is if they're new to Medicare, T65, aging in both A and B, and or they've delayed Part B and they're new to Part B, then that is a open enrollment app. As agents, we're predisposed to say high five 65, you are guaranteed issue, and the client's eyes light up, right? So sometimes we have to kind of refresh our memory that per CMS guidelines, underwritten is underwritten, of course, coming from one med sup to another med sup to us any time of the year, or in the annual enrollment period, coming from MAPD to med sup, underwritten, open enrollment, new to Medicare, new to Part B, and guaranteed issue is a guaranteed issue situation. But I always want to make sure I re-educate agents on that, because they will sometimes push an open enrollment app through as a GI, and it will slide through. But then we have to cancel the app and make sure we chase our tail back to the member so we can make sure we're paid effectively for open enrollment versus GI. Speaking of payment, so any day between the 1st and 31st, and can be as soon as the next day. So initial payment is any date between time of application and before effective date. So make sure when you go and write that application, the system will always default to the day of application. We always want to pause in that moment of excitability and making the sale to simply ask the member, what day would you like this premium to be reoccurring? Because many times people just speed right through it, and then that premium draws a little bit early and it doesn't really fit someone's billing cycle. So just always pause and make sure you ask the prospective member, what is a good day, that you want your payment to be drawn out. And again, as long as it's any day before effective, then it will go through just fine. So attestation always has to be before effective. So bank drafts are reoccurring, can be anytime between the 1st and 31st. And if they ever want to change their draft date, they can simply call member services and they can adjust that to fit their budget. And then we only take EFT as form of payment. We have flirted about doing credit card payments in the future, but traditionally I'm kind of a little bit old school when it comes to, a scale of 1 to Medicare. Just like life products, med subs traditionally with most companies are still EFT. So I kind of want to just keep the shoe fits, wear it there, is my personal opinion. But we are flirting the idea about doing credit card in the future. So if it's EFT, then I always like to say digital app, digital payment, paper app, paper payment. So if they do a digital app, which is a majority of the applications, it's going to be EFT. If you push a paper app, then it's going to be paper check. So resources, lots of resources, not just for members, but also for our brokers and our agents as well. So through allstatehealth.com, lots of agent resources. So agent tools and info, explore coverage and options for individuals, collaborate with us at Allstate, and marketing materials. But like I always tell everyone, if you need anything at any time, just give me a call. I'll take care of it for you. Tons of member resources as well. So we have a physician finder tool. So if someone's not happy with their doc, you can always do your due diligence as an agent and look up a new doctor for them, even though there's no network discretion with a med sup, but it's what we do for our members, right? You can also view general policy documents and view their policy information on myallstatehealth.com or myallstatehealthsolutions.com, and they can submit a claim. And we also have a member portal as well. Through myallstatehealthsolutions.com, they can actually save this on their mobile phone. They can register their fitness device. They can view policy docs. They can check current and past payments, payment methods, and they can download temporary ID cards. Very, very simple. So a little recap about our med subs. Protects us from out-of-pocket expenses, multiple premium discounts, which we love, multiple options from which to choose from, flexibility to see any doctor or go to any hospital that accepts Medicare, 30-day free look, and guaranteed issue policies where available. Any more questions on MedSup before I dive into DVH?
Rory, I have a question. Is
Good.
Allstate a captive agent company?
No. No. We simply efficiently work through all of you vicariously. So when you guys win, we win. No, we do not have captive agents. We have exclusive agencies like our brick and mortar shops, but those are more PNC side of things. And then we have our EFS agencies. Those are exclusive financial services. There's a complete separation of church and state. Allstate Health operates completely independently from Mayhem. So Mayhem up in Chicago doesn't pull puppet strings on us. We are the company within the company. We operate completely independently. No, we do not have captive agents.
Rory, do you
Okay,
have
thank
any affiliation with or preferential PDP plans that you work with?
Good question. We do not have any PDP plans. My easy advice to that, depending on what PDPs or prescription drug plans you contract with, one thing I teach agents a lot that is an easy tool when you're working with a prospective member. And there's a lot of med sup writers out there that don't want to do all the 8,000 research, and they don't want to do AHIP because you don't need AHIP to sell a med sup. And there's a lot of med sup, writers out there that don't dabble with MAPD and all that because of the Part D element. So if that's the case, then I always simply say, hey, go to Medicare.gov, put in your zip code, plug in your medications. They revamped their website a few years ago. It's gotten a lot more user friendly. So once you plug in your zip code, you plug in the medications, you hit the preferred pharmacy. It will ask you, hey, do you want to log in? No, you don't have to log in. But easy tool, rather than shuffling through a lot of kits and books, unless you really intimately know your PDPs that you write with, because they do change a lot incrementally from year to year. And many of them pay just a chip of commission, or some don't, right? You can simply guide the member, and let's take a look at Medicare.gov, plug the zip code, plug the medications in, pick your preferred pharmacy, hit go. And it'll show you right there the cheapest plan that fits the profile up to the most expensive plan, because the most expensive PDP plan is not always the right fit. But we don't dabble into the Part D game. The crystal ball hasn't even shown that on the horizon. I mean, it's probably 5-10 years down the road, because if you're going to get into the MAPD or PDP game, I mean, we literally would have to employ like a whole new mega division of the organization. So we're kind of just staying in our lane, with individual products, under 65 products, senior products, and the freestanding benefits. So yeah, we really don't have a roadmap to get into that game anytime soon. But great question though. Do get it often. So a little bit about our DVH plan. So we have our dental, vision, hearing plan. I know it's very creative from a branding standpoint. We spent a lot of money with these advertising agencies coming up with the name for it. I'm just joking. So yeah, DVH, it is a true PPO plan and a great bundle with our med sup. So there's no waiting periods, benefits available day one, very highly competitive benefits designed to beat or meet competitors. We do a lot of competitive landscaping, so I've actually seen a lot of the competitors' DVH plans, and we are very competitive. So we have increasing annual benefits or graduated benefits, and we use Aetna Dental Network. So basic premise of business, right? Buy, build, or partner. So we don't have our own network, so we rent one from Aetna. And we have denture and implant coverage on level 2 and 3 plans. And this plan can be sold as a standalone plan for people 55 and above also. And that's why it has the H in it, the dental, vision, hearing element. So the dental is the core product of the plan. The hearing is built on for free, and the vision is a la carte. So they can choose to add the vision on. It's an extra $10 or $17 a month, or $10 or $19 a month, depending on the state. So here is our overview of our dental benefit. Won't focus so much on level 1, mainly focus more on level 2 and level 3. Level 1, it's kind of cheap and easy, but you'll see in the next slide where a lot of the services say not covered, not covered, not covered. And I always like to say, let me tell you what I can do for you versus what I can't. So it's a true PPO plan. So it has an in and out of network benefit. But for all of us on the call that have sold a lot of dental plans, it's always best practice to make sure we sell in network. Yes, in the emergency where I have to go out of network to see a dentistry, it's going to cost a lot, as we know, or God forbid, an emergency dentistry. But in network is going to be always best. In our under 65 or individual plan bucket, we do have a dental indemnity plan. So if you're in a network deficient area or a network desert, you can always pull that plan out. We're looking to move that over to our senior bucket soon and call it a senior indemnity and dental indemnity plan, but it can be sold to people that are 55 and above as well. Individual deductible only applies for anything beyond preventative services. So 100% coverage for your preventative services, your cleanings and x-rays. And then you can see, like on level 2 and 3, from day 1 coverage. And that's one thing I want to point out. We have day 1 coverage and no waiting periods. So very important here. Many plans have waiting periods. So that's one thing I like about our plan, day one coverage. And then we have graduated benefits from year 2 beyond. So you can see on level 2 and 3, it goes from 25 to 50, 50 to 100 on basic services, which is like fillings and extractions and such. So it has that stickiness, that retention value, because people want to live in the plan for more than 2 years so they can get those elevated benefits. And you can see like I don't like level 1 plan because so many things say not covered. So in a nutshell, you can see graduated benefits on level 2 and 3, but no implant coverage on level 2. Yes, denture coverage. And then level 3, we have implant coverage. And then we do have some annual max benefits that are increasing year 2 beyond. So we are looking actively at revamping this plan. We work very heavily with our product team and collaborate often on monthly meetings. So we're looking at maybe trimming the fat on the premiums of the plan. We're also looking at increasing the network, and we're looking at increasing the benefits, like increasing the max on the plan. So more to come on that. So we're going to have some productive changes on this plan. So again, we use the Aetna network. I believe I may have sent this link over already, but again, I can send this out to you guys anytime. I have what's called my agent toolkit email that I send out to all my agents with all my helpful links and attachments and everything. So very, very expansive network, 89,000 providers nationwide, an average discount of 43.5%, and true PPO plan. So a little bit about our vision benefit. So again, the vision benefit is Avisus. So if anyone's familiar with Avisus, it's a very comprehensive vision network. We work with all the big box retailers as well as the mom and pop opticians as well. So very comprehensive network. We have a level 1 and a level 2 plan. Basically the level 1 to the level 2, as you can see, basic laws of insurance, right? Higher premium, lower copays, lower premium, higher copays. So the difference of $10 to $19 added on a la carte or as a rider to the plan. And you can see level 1, eye exam copay $15, level 2 is $10. And then one thing I like on level 2 is you have bigger benefits and less frequency of time. So you have elevated benefits on level 2. So 200 over 12 versus 130 over 24. Same on the lens package. So 25 over 24 versus 25 over 12. A little bit more about our lens package benefits as well. And you can see discounts all the way down the board, because I always joke and say going to the eye doctor is kind of like going to get your oil changed, even though we have our Mint magazine or Money Pages coupon we clipped out for Jiffy Lube. We go in there, you guys know this story. They say, hey, go grab a cup of Joe. We'll see you in 20 minutes. And then they come back, hey, the manufacturer recommended that, you have these new fluids put in and you need full synthetic. So that coupon's not going to work. But here, I'll type on the keyboard. I'll give you the managerial 10% discount. And oh, by the way, you need wiper blades. You need a new filter. So same thing when we go to the dentist. Same thing when we go to the eye doctor. Once they're under the hood, they're trying to find you an upsell path here. So really nice discounts on all the lens packages. And most importantly, I like to point out the progressive one from level 2 to level 3 is a big jump. So it goes from 55 up to 135. So paying a few extra bucks for the level 2 coverage is really great. And speaking of getting paid, we have some awesome bonuses. So our Q1 bonus structure right now is for our MedSup DVH bundle. We like to be very competitive and very creative on a quarterly basis. And we like to pay our agents well. So for Q1, we have a MedSup DVH bundle bonus. So this graph below kind of shows you an illustration of the bonus structure. So in a nutshell, any application that you sell a MedSup with a DVH bundle, no minimum, no maximum. So if you sell one bundle, 1, 2, 3 apps, any count is going to give you a $100 kicker for doing the MedSup DVH bundle. To hit the next bonus plateau for MedSup, the qualifier is 5 underwritten apps. So if you hit 5 underwritten apps, we're going to give you the extra $100 kicker bonus for all 5 apps. then any open enrollment app on top of that gives you an extra $25 kicker bonus. And then you can see below, if you bundle it, then it really starts to climb. So you're kind of doubling that DVH bonus. And the column to the right is a bit advantageous, but I got some big writers out there that do hit these numbers on a quarterly basis, especially during AEP. And we have similar bonuses that we roll out Q4 as well. So if someone hits 20 plus apps for the quarter, then the bonus is double on underwritten and OE apps. And it also will double your DVH bundle bonus. So got a lot of agents that are writing a lot of great combo apps this quarter and cashing in. So even if you're doing onesie, twosie, threesie apps for the quarter and you're writing a DVH combo, give yourself an extra $100 kicker bonus and you get the regular commission schedule as well. Any questions on that? All right, moving right along. I do have a nice flyer I can send out on that as well, which kind of has a similar illustration. And then coming Q2, we're going to have some new fun bonuses moving along. And we do have our final expense policy launching at the end of the month as well. So we got lots more training and lots more to come on that. We're real excited about that. And so be on the lookout for more communications on that. So again, this is our regional support team. So if you had a chance to take a picture of this slide earlier, or if you want to scan the QR code, you can take a moment to do that now again. Eric Almasy, of course, is our regional director. Mary Steele handles our under 65 products, and myself, Rory Gregg, I do all the senior products. And then our go-to lady internally at HQ is Misty, and she's awesome. So she handles all of our contracting and commissions and all that cool stuff behind the scenes. Questions. So this is my contact information again. Open door policy at any time. Like I mentioned when we warmed up, it's all about the white glove and red carpet treatment at Allstate Health. We are here to immerse ourselves into your business. When you guys win, we win. We want to fit into your model, and open door policy at all times. If you need something, you give me a call. If I'm not available, leave me a voicemail. I will always call you back as quickly as possible. So I'll stop
Rory,
sharing.
I have a couple of questions.
Yeah, go ahead.
Okay, first question is, maybe I missed it. You showed us a bonus. Did you show us a regular commission schedule?
You probably have to go through Stonehill to get that, depending on your uplines through your FMO and all that. I don't really have access to those commission schedules, but I could find out, but I'm sure some of the management team or whoever handles contracting can give you a layout, because larger FMOs like Stonehill and other, they have different, commission schedules than just our direct, tier 1 commission schedule. I could kind of give you a breakdown, like a basic tier 1 commission schedule for Med Sup is going to be 24% for years 1 through 6, 1 through 7, depending on the state. And then year 6, 7 thereafter for the life of the plan, it drops back to like 4.5%. But you guys might be at a different tier. So again, I don't really talk commissions too much. I usually kind of 3 it out and punt that one, but that's just kind of a basic overview. But again, at Stonehill, you guys might have a different agreement. I can always have Misty send that up to the management team there to distribute down below, or I'm sure they can tell you what your commission agreement is, because people either pay direct as a independent agent, but if they're part of a larger upline, then we usually have a different commission arrangement.
Okay, that answered that question. So the second question I think you also answered, which is we contract with Allstate through Stonehill, correct?
Yep. As far as I know, yes.
So I'm going to say yes, Alexius.
Yeah. Doug would know more than I.
Yeah. Well, Rory, thank you very much. I found this informative. It was
Yeah.
good to review some of the Medicare supplement rules and things that you guys are doing. The Allstate name carries quite a bit of weight. You guys customarily appear near the top of the CFG quote tools.
Yeah.
So there is quite a bit of interest in the Allstate Medicare supplements and the other products that you have.
Yeah, I
So
appreciate it.
everybody, we're gonna post this out on MedicarePlanDetails.com, so that if you want to review that, go over it again to do some things, you can. It'll be posted by Monday afternoon. It is for Medicare. It is for health agents, not for consumers. That site, Medicare Plan Details. So you'll have to use a password to get in. It's Advantage with an uppercase A. And Rory, thank you so much. We will be in touch.
Yeah,
And
I really appreciate you having me. Very flattered to be here. If you're looking for any new topics to go over at any time, please let me know. We can create, some continual education on various topics. If you're looking to like do a deep dive on other products, if you guys have monthly meetings, quarterly meetings, I would love an invite anytime. I do that for a lot of my big agencies. They invite me on like once a quarter to go over various things. And again, if you have any subjects or any other products that you want to deep dive on, or if maybe like next time you guys want to have me on and we can kind of focus specifically on doing like a drive through of our quote and enrolling system, or if anyone needs any one-on-one training at any time or refresher training, open door policy. Just give me a call. We can set up some time. I have a simple, email Calendly link I can send out to you at any time. You can grab my calendar at your leisure, or we can just, schedule a Zoom or a Google Meet anytime. I think we had a question come in from Gene.
Yeah, just wondering if you've got some kind of a pricing schedule or something for the DVH specifically for Utah, but if you've got one that covers everywhere, that would be great.
Yeah, slightly different flavor for each state because DVH isn't offered in every state. So your average, say your average premium on level 2 and 3 is going to be the difference between like $35 to $50. Couple dollars difference depending on the state as far as base premium goes for that additionally. But one thing to point out, because you got it top of mind for me, Gene, is in like Colorado and our states beyond where you can bundle, and I need to add this in the presentation, which I'll probably do today. We do have a bundling discount for the member. So in Colorado, if you do a MedSup DVH, the member gets an extra 15% off of their DVH plan. So not only a win-win for you, but a win-win for them too. In many other states, we offer a 10% discount for doing the DVH bundle with the MedSup. So there is a nice discount for the member as well for doing the bundle. I need to add that into the presentation.
Thank you.
Rory, can the DVH plans be sold separately, or do they have to be tied to a Medicare supplement?
Absolutely, Alex. Yeah, I mentioned that earlier in the presentation, but yeah, I'll reiterate that again for sure. Yeah, it can be sold as a standalone product, 55 and above. Absolutely.
Okay, thank you.
Yeah, no problem.
You mentioned
Good
55 and above, but
Mhm.
what about someone who's under 55, but they're on Medicare because of disability?
Good point. Since technically it is a senior product, it qualifies as 55 and above. Now, if someone is, unfortunately on disability and they're under age 55 on Medicare early on, most of the time they're going to probably be on some type of MAPD plan that's going to have some type of fairly decent dental benefits. As we know, some of the pitfalls to the MAPD dental services is the network, right? Because it's going to a lot of times be, depending on the state you're in, it's going to be your strip mall franchise dentistries, and sometimes the benefits work really good and sometimes they don't. But as a standalone, dental plan on our under 65 side. So anyone basically 64 years and 10 months and under can still purchase our individual dental products. I'm very well versed in them, but that's more Mary's cup of tea. But yeah, back in the day, I used to sell a ton of dental plans as well, because especially when I was doing Medicare Advantage plans, because I knew the lack of network or the lack thereof of dental services that just wouldn't jive for some people, especially if it comes to network discrepancy. So I would leverage the lack thereof benefits to then sell them a freestanding dental plan. So we have a really great dental plan. It's probably one of the most awesome dental plans I've ever seen. It's called Copay Plan 2. It's our hottest seller in the country for sure. So that's a great plan. Or if as a grandchild, because grandparents can purchase and be the payor for a plan. Unfortunately, 25+% of grandparents these days are raising grandkids. My parents had to do it at one point in time when my oldest sister passed away many years ago. So yeah, so you can sell the freestanding plan for a kid. If it's someone 26 under, especially someone that needs orthodontic, I would recommend our Prime plan. That's the one that's really good for juniors. But yeah, for under 55, Copay Plan 2 is excellent. If you see someone that's treading into the senior years, they need that denture work, they need that implant work, then that's where DVH comes in, because dentures and implants aren't covered under our freestanding dental plans. But yeah, hottest sellers for sure for juniors are going to be your Prime plan, and our hottest seller for under 65 is going to be the Copay Plan 2. It's an awesome plan.
If you've got somebody that's on a Medicare Advantage plan and you sign them up for the DVH, can you talk about how coordination of benefits works?
Doesn't. Yeah, it doesn't. It's a freestanding plan. So there might be some MAPDs out there that say they coordinate benefits with freestanding plans, but that, in my experience, that's muddy water there. It never tends to coordinate as well as we think it can with the dentistries.
Well, if you've got a plan that pays 50% on your Medicare Advantage and you have this, is it going to pay the other 50%?
No.
Or it'll say, no, you've already got other coverage.
It's kind of like being at a casino, right? You don't always show them all your cards, right? So you can show them the MAPD card, express those benefits till they're expressed, and then your freestanding plan will pick up once those benefits are expressed. They will not coordinate because it's basically two different policies and two different companies. Now, the dental indemnity plan that I spoke of, which technically is in our individual under 65 bucket, it can be sold to seniors as well. So that could be a situation where you could look at like plan to sell them to kind of cover those things beyond those benefits that are expressed. So basically, they would just file a claim to the plan and then it would reimburse them for the out-of-pocket expenditures. Good questions, though.
Thanks.
Well, Rory, thank you very much. And for those of you who have been asking questions, I sure do appreciate your engagement.